taking purposes. And I guess with that, I'd ask that everyone please keep yourselves muted. But if you'd like to share with the group or if you have a question, please use the raise your hand function or type your question or comment into the chat, and I will make sure to help task force members address your comments or questions. So with that, I'll start with roll call here. Switch over to, okay. So if the members would just unmute yourselves when I call your name and just say whether you're present or not. Caressa Gibbons.
Present.
Kevin Kushel.
Present.
Mitch Henke.
Present.
Montavious Jones.
Present.
Claude Kroschek.
Present.
Nicholas Lajoie.
Here.
Dan Rufus. Absent. Cynthia Tayez.
Present.
And Andy Tillman. Absent. All right, with that, I'll hand it over to Caressa for minutes.
All right, we're just going to approve May's minutes. I approve, and if you get a second, that would be great.
I can second them.
Okay,
Move for approval.
Okay, excellent. Well, we'll get right into it. I actually invited Kiran to meet with us today to talk a little bit about what she's been up to with the School of Urban Planning through her focus in public health. I won't take up too much of her time. She's got about 10 minutes, but I just wanted to do a little bit of intro in terms of how she fits in with a lot of the work that's being done with the Wisconsin Bike Federation, Milwaukee Safe and Healthy Streets, as well as the Department of Public Works and other city departments over the last year to improve systems in which are established in order to improve the condition in the public right-of-way. So many of us have heard of systems change, some of us haven't. But if you haven't heard about it, it's essentially a way of looking at all the functions of a particular organization or a group of people and how they're all working together in order to affect change. Instead of isolated particular incidences, looking at the whole ecosystem. So that's what we call systems change. And a part of the systems change that we've been all working on collectively over the last 3 years is making sure that we establish models for evaluating perceptions of not only of traffic safety, but also our personal perceptions of our health, are both mental and physical. So Professor Schneider from the School of Urban Planning had put together a wonderful model, like a survey model, to get information from a vast array of zip codes. And from that, Kiran has taken parts of that feedback on public health and safety and done her own project. So I'm going to hand it over to Kiran so she can tell all of you more about it and not take up any more of her airspace. Kiran, does that help you? Is that good?
Hi, Carissa. Yeah, that works. I just wanted to I thought it would be a great idea to be able to present with you leading it together, since this is something that we had both discussed towards the end of the semester. So thank you guys for having me. This research project was a part of the grant that Medical College of Wisconsin and all of the organizations that Carissa had talked about had been involved in. And for the research that I wanted to do, I really wanted to look at the communities in Milwaukee and to determine specific areas that could potentially benefit from that systems change, those systems change pieces through the route of complete streets policies, using that as one example or of a way to improve not only the traffic flow in Milwaukee streets and neighborhoods, but also improve and contribute to perceived safety and health outcomes of the populations that live in Milwaukee neighborhoods. So in order to do that, first I took a look at some 5 specific questions that were from the Safe and Healthy Streets surveys that had been distributed to Milwaukee residents. And there were 801 survey responses that were collected last year from the 2020 surveys. And then, yeah, from those surveys, I looked at 2 questions or 5 questions, and analyzed 2 general variables. These were the Milwaukee perceived safety, or Milwaukee resident safety perceptions, and their general health outcomes. For their safety perceptions, there were 2 questions that asked residents how safe they felt while using various modes of transportation. And these modes of transportation included walking, biking, using a car, getting on the bus, and then ask them to rank how safe they felt. They could choose from 5 different responses that they could feel very safe, very unsafe, safe, unsafe, or neutral. And then I assigned numbers to each of these responses in order to quantify them, to do a statistical analysis with the data. And the 2 separate categories of perceived safety were traffic safety and crime and personal security. So residents were asked how safe they felt while walking and biking in regards to traffic safety, and then crime and personal security. And I wanted to use these to analyze the relationship between walking and biking and the built environment. And then I was able to create a safety and security score based off of these 2 questions and modes of transportation, and organized these responses according to the 15 alder districts in Milwaukee, and came up with 4 different safety and security scores. And then the next variable that I looked at was for health, and there were 3 questions that pertained to health. The one that I chose to show and illustrate on the map with my executive summary was the question that asked residents to rank their general health, how they felt. And they were given the option to choose feeling poor, fair, good, very good, or excellent in regards to general health. And then 2 other questions were how many days out of the last 30 days how many days out of the last 30 days within taking the survey residents felt not good regarding physical health and mental health. So I really wanted to see if there was a relationship between general health ratings and then safety and security. And so I used proportions to create this map that was on the executive summary to highlight specific alder districts 1, 2, 5, 8, and 12, and 15 that had some of the highest percentages or proportion percentages of residents that reported feeling poor or fair in regards to general health. And then when I compared these districts or percentages to the perceived safety rating scores based off of alder district, they also corresponded or overlapped with the alder districts that had some of the lowest perceived safety and security scores based off of those 2 questions. And so I then also did correlations using statistical software between these variables, and found that there was a significant relationship between perceived safety and general health outcomes, where essentially residents that had reported feeling generally safer regarding traffic safety and crime and personal security often responded having more better, higher perceived general health outcomes for themselves, and lower numbers of days of not good mental and physical health. So based off of these conclusions, I recognize that it could be really useful to be able to share this with you guys as a group, and then other individuals in Milwaukee to help raise awareness and share that there is this relationship between health and perceived safety and security, and to recommend that there be built environment changes or systems changes done in neighborhoods in these older districts in order to improve not only, again, traffic safety and crime and personal security perceptions, but also general health outcomes like being able to decrease the rates of obesity and chronic illness such as heart disease and diabetes that are also linked to how safe people feel, because if people aren't feeling safe, they're feeling stressed to walk out and like bike or bike and like walk in their neighborhoods, and so those are all intertwined with one another. But in the future, one thing that I noted based off of the literature is that there must be community engagement that's done with residents in these neighborhoods where the infrastructure changes are being proposed, just due to the negative historical impacts of disinvestment and lack of hearing residents' voices while planning and integrating different changes in the infrastructure in their neighborhoods. So that's the gist of my research, and I'll open up the floor, I guess, for questions from you guys. Thank you.
Well, Kieran, thanks so much for visiting us and sharing this information. For those of you who might need to reference some of the things that Kieran was talking about in the agenda, we do have a link to Kieran's executive summary that I have asked her to put together. So it's very nice, Kieran. Thank you. I am going to put out a few questions to everyone, and you might have your own already, but I do want to emphasize a few things before we hit 4:55. Now, there's a lot of iterations of this kind of data out there. I think many of us have reviewed this, but also just anecdotally, we see these issues, especially within Black and Brown neighborhoods where there's an incredible amount of disinvestment. However, one of the reasons why I brought Kieran here is because I really liked seeing young people with fresh concepts, energy, trying to address these issues and push them to utilize the things that they do within their academic study to actually try to leverage for change. So the question I want to pose to the member body and also to other people who are here is, how can we help prep up this important information to possibly leverage for change in the future, thinking of things like budgetary means, etc. So I'm just going to put that out there. Kieran, again, thank you. And I think Montavious had his hand up, and I'll go over to Montavious.
Yeah, thank you. Hold on. Okay, there we go. Thank you, Carissa, and thank you, Kieran, for presenting this important information. To quickly answer or respond to your question, Carissa, how can we, share this information, prop it up? I think a lot of times, well, actually, I know when things come up before the Common Council, you can always submit comments, and you can have things entered into the record. That they have to put on record. So this could be something that when we have things that we think are related to this, different ordinances or whatever comes up at Common Council meetings or at committee meetings, we can have this entered into the record so that we have this information out there and it's public, and then people can say, oh, we didn't know, and it can help inform decisions about things. So that's one. But I want to ask you, Kieran, at the end, you said it's important to have community input about any interventions that happen in communities. Was that part of the research, or did you just find that in your lived experience, or that's important, or do you have like some facts and figures to support that?
That's a great question. That's a part that there was nothing that like I looked at from survey data that was collected to analyze and come to that conclusion. That was based off of, I thought it was an important piece that I needed to make sure that I included from literature, that I went out and like made sure to include, because I knew that that was a fact that communities of color, residents from these communities had not been heard, and there has been disinvestment just based off of like case studies that I'd read about in classes. And I've seen it, I feel like, just based off of living in the city of Milwaukee, just recognizing the stark contrast between going from different neighborhoods that are so close to one another, and then recognizing one set of streets has streetlights and like the streets are clean, and the other like side of like a bridge doesn't have any like it's real bare and very like, people might not feel the best walking, there if it's a little bit later, you know what I mean? So yeah, that's how I added it to this research. Another person, Nicholas.
Yeah.
I do.
Hi, can you hear me?
Yep,
Yep.
I can hear you.
Great. Sorry, there was an echo there for a second, but I don't know if that was me or not. Yeah, I want to say again, echo what Montavious mentioned, and thank you again for this really important study. A couple things that I quickly want to mention that I think bringing this report to the Common Council, I think it would be really meaningful, important step to do. And I was wondering if you might have like an expanded version of the executive summary available, which I'm sure you've got the full report available, but maybe something with a little bit more extrapolated data. Specifically, what I'm thinking of is not to play devil's advocate, or maybe to play devil's advocate, but I can imagine that you probably get some questions about the correlation, which I know, and we know, we've heard from other studies, exists between perception of the question about perception of general safety for pedestrians and bicyclists, and then the perception of safety of crime and safety in neighborhoods, and how that relates to the built environment. So I'm wondering if you might have some other of the other maps with the data that you've got that show how they directly correlate and kind of like, connect the dots very clearly in a summarization, or maybe it's in your full report. But I do think that point would be important to clarify, because the this one pager is really good at kind of getting the whole study out, but I think there might be a possibility of people saying, oh, well, somebody might have concern about crime and safety in the neighborhood, but does that necessarily correlate to the built environment? And which I think it does, and I think there, I'm sure you have many points in your study that show that, but it's not clear in that kind of one-page summary. So that's just my commentary. But yeah, otherwise it's really great, and I'd love to see the full report too if you've got that available somewhere, and I'd love to read that. So thank you.
Thank you, Nicholas. Yeah, I have written a full report for my master's project. We had to complete one. There were quite a few maps that I was considering on including in the final report, but due to space, I hadn't included them. But I did make maps that had like those safety scores or proportions that I had created. And I wanted a chance to like get to like do a side-by-side visual comparison with them, just to emphasize the fact that, all right, this Alder District 1, it has a high percentage of poor and fair general health response percentages, and it has this like a number 43 perceived safety regarding traffic safety, like for example, just and like to have that to like those maps side by side to strengthen the like proposal to do something in in neighborhoods in that Alder district. Is that what you were asking?
Yeah, I think that's sounds like exactly what I'm thinking of. I'm imagining having maybe a second sheet with those other maps that you're talking about, and it's just very clear then to see that, yeah, these are directly correlative to each other, just to really kind of hammer that point home. I think that would be helpful for maybe some people might not need that, but I think that might be helpful for some people.
Mm-hmm. Yeah, and I was also thinking, I mean, I've seen other like Milwaukee maps that have been organized according to Alder district. Just for example, with like coronavirus cases too, and like recognizing like using heat maps and seeing that Alder districts or like those like areas with like higher for example, coronavirus cases had been located in these Alder districts as well. That's another, I guess, interesting like thought that I came across. I'm like, can I include that? But it was kind of a tangent, but I thought it'd be also important to also see and recognize and consider.
I'm sure you could have a number of different maps, including investment, in public projects, and all kinds of maps that would probably have very similar connections between each other. There's probably a lot of correlations that can be drawn. So, but yeah, I'm a visual person, so I definitely think that maps like that really help get the point across without having to say too much.
Okay.
Definitely.
Well,
Thank you.
Thank you, Kieran, very much. I do think Nicholas, I think it would be great for Kieran to get that information to you, and perhaps it could be something that's discussed further in working groups. And lastly, I do challenge anyone here, and especially our member body, to consider how this information, in part or in full, can be presented to our lawmaker body, and even in a more specific way. One way we talk about increasing our capital budget for multimodal projects, excuse me. Also, we've got a big federal stimulus coming down the pipeline that the Milwaukee Safe and Healthy Streets and the Bike Federation have published recently, that might be advantageous to make sure that our lawmakers know that those particular areas need to be focused on. So we're going to move on to the next agenda
Carissa,
item.
if I could just jump in really
go
quick.
ahead.
Karan, thank you very much for the presentation. That'd be awesome. If you want to send Carissa and me any full reports or maps that you would be happy to share, I can share that with the rest of the group and our guests. And from DPW's perspective, and I didn't say who I was, by the way, but James Hannig with the Department of Public Works. We'd be happy to look at those maps as well, and especially looking at like an Alder district by Alder district, and how we can kind of look to prioritize projects and investments as well. And I think we can share this with hopefully the Office of Equity Inclusion, which I know they're doing some data collection and mapping around disparities throughout the city too. So they may be very interested in that. So, all right, thank you.
One last thing, sorry, Cynthia over here on the phone is a little difficult for me right now. I never do calls. But thank you, Kieran, for that information. I also wanted to say that thing on the community side of things. There are, I think, multiple neighborhood organizations within my scope of work that have very drafted plans regarding a lot of the points that you touched on. So I wonder, for our working groups, an item, for our agenda could be exactly like how do we sort of work in parallels, and into presenting this to, the city council, along with support from these neighborhood organizations and neighborhood residents, that understand the data and that can see, the direct correlations with what the data is showing, and hopefully build, a strong case to be presented on there. But that's all I wanted to say. Thank you.
Excellent. Sorry about that. I didn't mean to get hasty.
And I did
Moving
see
on.
Kevin has his hand raised, so I didn't want to miss that. Sorry.
Sorry about that. I'm just steamrolling everyone. I'm so sorry. Kevin, what do you got to say?
I did also want to thank Kieran. Thank you for that presentation. And I think things like this are incredibly, incredibly important. So especially when we look at it from data, I think that can be very convincing. At least I get convinced by that. Looking at the executive summary, I noticed that Aldermanic District number 4, which is the downtown district, is one of the ones that is perceived as most safe. I did do work with Professor Schneider before, and in that area, well, it's the downtown area, and it's part of the high injury network. And I was wondering how the data that you've collected and the research that you've done compares with the high injury network here in the city of Milwaukee. And is there a correlation between, the high injury network and how people seem to perceive safety? Because I get downtown is incredibly dense. There's a lot of people that are walking there, but it's also one of the areas that is on the pedestrian high injury network, in addition to many of the areas that you've highlighted. So I was wondering how that would relate.
Hi, thank you for your comment. I have not been able to look at data from the high injury network. Is that in a report?
It's located on the city's website, so you can even just Google keyword for anyone who's interested. City of Milwaukee pedestrian plan, and within that plan, they have actually broken it out into various sections. So you will probably find the high injury network information on probably maybe the first or second link on the page, and that way you can go straight to it. But the whole thing is quite vital. It's a good plan.
Yeah, I think that that would be a really great point to consider, to look at and understand why with this research. I think that yeah, I was more I guess I got caught up on recognizing I hadn't looked at the high injury network report. What was your question again?
I'm interested in seeing how the perception follows with the high injury network, what we've actually seen. And that doesn't mean that the high injury network and the research and the data that you've collected are go head to head. I'm more interested in understanding the perception versus, just because an area is a high injury network doesn't mean that, we need to be focusing on it necessarily as much as other areas. There might be other reasons for it, but I think it's valuable to look at both perception and what the actual consequences are, right? With the high injury network, etc.
Yeah, I think that there could be definitely other contributing factors that I wasn't able to look at as variables that would be contributing to individuals feeling safe in an area that is still a high injury network. That was something I know Rob and I had talked about, or Dr. Schneider and I had talked about, our those third variables that I wasn't able to consider given the breadth, the time frame that I had for research and the data that I had so far. So I will though take a look at the high injury network report and check it out.
Sure. Yeah. So I did notice that James just posted the pedestrian plan, and the information is in that as well. So you could get a direct link to the pedestrian plan in the chat.
All right. Thank you, guys. Thank you.
Okay. Do we have any other questions or comments for Kieran? All vital. Well, I guess, Kevin will just stay on the mic there. And what have you got for us? Or actually, no, it's not. I'm sorry, I'm skipping ahead. Are we talking about safe routes to school? My bad.
I think we're me right now.
Okay, great.
Yeah.
Sorry about
All right.
that.
So we're going to finalize this and this mission and vision statement stuff that we've been doing. So if you'll recall from last week, or those of you who are coming here and missed last week's meeting, totally fine. We broke down the mission in, well, the exercise was to look at the statements that we created before and come up with the action words, the cause, like the, let me look at what I've created so far. So our causes, our actions, and the impact that we intend to make. So what we're going to do now is we're going to look at those together, but in small groups. We're going to divide into 3 small groups. And from those, we're going to create a mission statement, another mission statement, but this one is going to be a little bit more concise than the first ones that we created. We're going to use the themes that we developed last time, but I'm also going to provide you with the Jamboard links to go into the notes from last week, so that if there are some things that you think should have been included in the themes, you can definitely add that. So we'll break up into groups for 10 minutes, and then we'll come back and we'll discuss the more concise mission statements that we've created. So all the statements, they should have a cause, an action, and an impact. So for example, this is just something that I came up with really quickly when I was looking at this, and I used basically the words that we had, or the themes that we had come up with. And so this would be an example. So we help community and public stakeholders through proactive outreach and support elevate the status of walking and biking in the city of Milwaukee. Hopefully we can come up with something a little bit shorter than that, but it just needs to have an action and a cause, an action, and an impact. So does anybody have any questions on that? Okay, so if not, there's the link for the statement, crafting the statements, and then these are the notes from last week or last month. And then James, oh, when we're in the group, if somebody could be designated the note taker, that would be amazing. So that, I mean, you're more than welcome to use the Jamboard link to create your statement. But when we come back, I'm going to ask everybody, every group. So we should ideally have three mission statements, and I would like us to post those in the chat, and then we can discuss them. And then from there, we'll create the vision, or start thinking about the vision, and then we'll come back next week or next month and share what we have finalized. So I see. Oh, let me see if I can share this. I don't think I did this correctly. So let me share the link again. I'm noticing that people are coming in and I didn't actually make it public. Okay, so the first link that I just posted right now from 5:06 p.m., that's from the notes from last week. And then...
Hey, Kevin, you keep saying last week, but you mean last month?
That is exactly what I mean. I am sorry. Thank you for calling me out on that. And then the second one is now there's 3 different groups, but they're exactly the same thing. You can go into group 1, group 2, group 3, it doesn't matter. But I want 3 different statements, and after we come back from our groups. So James, if you could split us up and we'll reconvene at 5:20.
And I'll provide like a 2-minute warning once we're getting close.
That sounds great. Thank you.
It's saying it's view only. Are we supposed to be able to edit these or?
Well, the grouping exercise, I'd prefer if that stays the same. If you begin to edit in one group, I hope that you stay within that group. I can make that one editable though, if you're okay. If
Oh no, that's whatever you want. I was
no, I mean I think it's yeah, it was actually intended to be editable. So let me.
As long as like everyone's not editing the same thing, right? They're
Right. Yeah.
Just give me the okay. I'm ready to go when you are.
Okay, I think you can edit, but just in case you can't, I just posted the link that you should be allowed to edit in, and now we're ready.
For folks on the phone, feel free to just hang tight for 10 or take a nice little break.
Thank you. I was wondering about that.
Sorry, I think that's one of the limitations to Teams.
No, that's okay. I'm actually very actively listening. As today it's the opening for the active street over at Washington.
I know I really wish I was there. I really wanted to be there.
I know. Well, you'll have 11 more Wednesdays.
Exactly. Yep. And multiple other days.
Yes. Yes, absolutely. And today it's so nice that I feel like just last week was, it's like those odd Wisconsin weeks where it's super cold and it's windy, then there's really sunny, and then after that, okay, then you have summer.
Yep, exactly. Well, enjoy.
Thank you. Yeah, no, I'll be on the side until the meeting it's over. But I was just very excited to hear Kiran present on her project, and I wanted to definitely talk more, but I feel like a lot of us had a lot of also follow-up questions, and I'm also interested in just seeing the full report.
Agreed. Yeah, I definitely want to sink my teeth a little more into everything she has.
Yes.
All right. I have to leave here just a quick sec, but I'll be back in a minute.
Yep, I'll hang tight. Thank you.
Thanks, Cynthia.
All right, do we have statements, people? So, if you're like my group, we were just about to finalize our idea. Does anybody have anything that they would like to put in the chat for a mission statement? And I'm really hoping that we say yes, because I don't want to keep doing this again.
Kevin and Carissa, I don't know if I see her yet. I don't need a lot of time for my item, so if you would want to go back to the group, just let me know, and I could break back out if you need a little more time. But I'll kind of defer to you.
Is there a polling function on this?
No, we tried with a Mentimeter once, and it
That's
was
right.
messy, but it was
Well,
okay.
We were really close too. I mean, I think we could probably stand to use like 5 more minutes at least. Raise your hand in the chat if you would like 5 more minutes. I'm gonna raise my hand. Okay. All right. Brian wants 5 more minutes. All the people in my group want 5 more minutes. Are we back?
Yeah, let's just break away for 5 more minutes, and if
Okay.
the people that don't want to do it, that's fine. We'll get this done. Are we all back now?
Should be, yep.
Okay. We don't need more time, do we?
Oh, we're just in the middle. We were almost
We were
finished.
so close.
We were so close, and then you kicked us out again.
James, how dare you?
James, how very dare you?
How
Well,
dare
we've
you
got
do
two
what we
very good
asked?
ones from our.
That's okay. We were really close. I'm gonna, if my group trusts me to throw one out in the chat, I think I could probably do that.
Okay,
Brian,
I'll
what do
throw
you
ours in
think?
there too. It's basically a rewording of the example.
Go for it.
So the one that our group created was, we help community and public stakeholders through proactive outreach reprioritize the safety of people first.
This is Nicholas. It's funny because we basically reworded what you had too, and it's pretty similar. I'll post it, what we wrote, which is, we connect community and public stakeholders through proactive outreach and support to prioritize safer streets and elevate the status of walking and biking in the city of Milwaukee. Pretty close, but you're a little more concise.
No, I like it. I mean, I'm gonna be probably liking most of these, to be honest, just because I think that these things are important. But
So if we're going for the shorter the better, and I do think the shorter the better. Frankly, the first one that Kevin suggested it does say what we say, but with less words, if that's the goal.
yeah, that was the goal of our group, actually. We were trying to come up with something a little bit shorter.
The one difference we had was we changed help to connect, because that part of being the bridge between stakeholders was sort of not apparent in that first.
Mhm.
So that maybe that's something to consider.
No, I like that. Yeah, thank you. Caressa?
I just finished the last bit, and my group can chime in, but I have an alliance of residents and community stakeholders being proactive by way of policy change, resulting in safer and healthier streets for people walking and biking.
All right. So, the next steps, and Caressa, I'm going to reach out to you to have a meeting about this. We'll discuss these 3 mission statements. So I'm going to copy and paste them into a file so that we have them safe. And then we'll fine tune them or go with what we feel is correct on that, and then bring that to our meeting next time. But part of this mission and vision statement is also to start thinking about a vision, right? Like, this is the mission statement. What is the vision? And so in order to do that real quick, like, I want us to be done with this in just a few minutes, but if there's any discussion, I would love to host that right now. Why does this matter? And why do you know that the mission statements that we've created, why do you know that we can achieve this together? Those things are important. So if we want to have a discussion about that, that'd be cool. If not, if we just like to mull about it and talk about it a little bit next time, that's totally okay too. But this will help us define our vision.
Did you want us to talk about that now, or were you planning on putting this in groups to discuss that?
No, we would be doing this as a big group together, yeah.
Just really quickly, I just took what I just put in the chat, and I copied and pasted it and put it in our group's board.
Okay.
So for reference later, I don't know if folks want to do that, or I can do that for people so that we can look back on it. I don't know if we're recording, how we're recording those answers. But.
I also just copied and pasted it into a text file, so I'll keep that on my desktop just as a backup.
Okay, great. Could you incorporate it into those Jamboards?
The ones that we made?
Yeah.
Yeah, totally.
Okay, cool. Well, then
yeah.
talk amongst yourselves about the question that Kevin asked, because I think it was a critical
Yeah,
one.
so just to make it easier, I'll write them out in the chat, right? So why does this matter? And
This matters because we need to provide a built environment that allows more and more people to participate in the social and commercial life of their community. I don't like that more people, there's a better word for that.
Are we asking why what we do matters or why creating a mission statement matters?
why what we do matters. Thank you. That's definitely worth clarifying. Yeah, why what we do matters. And so I think in our group, in our small group, my group briefly discussed how we have a car-centric city. And in my mind, that's not a very equitable city because not everybody has a car, not everybody has access to that sort of transportation. So I think why we do what we do matters because we're trying to create a more equitable and safer city for everyone, right? That's the way that I see it. But if there is no further discussion on those two questions, that's totally okay. I would like us all to think about that.
Kevin, I think that Chris has his hand raised.
Oh.
Yeah.
Chris?
Yeah. I just wanted to point out that I think the importance of it would be multiplying our efforts. If any one of us wanted to do something, it would only go so far. So I think that's kind of the idea behind this whole task force in general, is just getting people in the same room virtually and making these things happen.
Thank you.
I know I'm not part of these discussions necessarily, or the breakout discussions, but I'll say I think it matters because it's unacceptable to have so many people fatally and seriously injured every year on our streets. And I think if no one else, who else would be speaking for the community if not the Bike Ped Task Force?
Thank you, James. I think please always speak up. You're always welcome to. I always value your opinion and your voice. Yeah, I think maybe just to say, in addition to that, one life saved is worth it. I mean, it's really about the life and health of our community. I mean, that's why it matters. It really just comes down to that.
Well, it's about a vibrant city. You can't have a vibrant city where people are uncomfortable walking or biking. Or using their scooter or whatever non-motor vehicle device they may be using.
I see Becky has her hand raised.
So in my thought, why it matters, why the bike pedestrian task matters, is that it's casting a wide net out into the city and ensuring that there is equity and inclusion, not only just in the projects we do, but hearing from the community on things that we may not necessarily as planners think about or designers, or even crash reports may show. So having a connection and hearing the voice from the community, I think that really matters as well.
Thank you.
One more thing too, I just kind of listening to that, I'm reminded of when we started Safe and Healthy Streets, which was Path to Platinum, which was Path to Gold originally. We were kind of asking the same questions about this as an advocacy group, and it came up, came around to thinking of all the stakeholders we're talking to have different interests, but these, the effectiveness of improving bicycling and pedestrian access and infrastructure in the city, et cetera, really speaks to everything from public health to equity to economics, as Claude mentioned. I mean, there's studies that show it raises land values in neighborhoods where there's protected bike lanes and bike and pedestrian trails and pathways. So there's an argument to be made for pretty much any socioeconomic factor is improved by addressing these issues. But I think for me, the top one is safety and saving human lives and preventing injuries. But I think there's so many different arguments that could be made for why to do this, right?
Right. Yeah, as I mentioned earlier, after the presentation that Kiran gave us, this is actually, I forgot what I was going to say. But yeah, the data show that this would be a more economically vibrant city. It would be a safer city. It's like everything that you said, that's what we can create here, right? And that's what I think our job is. That's our duty. That's our responsibility.
Kathy had a comment in the chat too. It also matters because our past choices have social costs that are much greater than many people realize.
Yes, and I wrote that one down actually. Yeah, sorry, Becky. I do actually forget things from time to time. I think Kiran has her hand raised.
So to answer the second question that was said, first of all, I think Nick brought up excellent points on reasons why the work that the Bike and Pedestrian Task Force matters and how it ties all those socioeconomic factors together, by choosing one key piece, you can improve so many different factors. But to say why do we know that the Bike and Pedestrian Task Force can achieve the mission together is, I think that it's because we're able to draw together so many different stakeholders from Milwaukee communities, and in order to achieve a systems change, you need many different players and individuals and groups and to be involved and on the same page. And the Bike and Pedestrian Task Force provides a channel or opportunities to have everyone be on that same page and have a similar perspective or understanding and say, look, there are these issues that are going on. What can we put our heads together? Each stakeholder bringing a different skill or points of pieces to leverage to contribute to making those changes that we can see that we know would improve public health and safety through street safety or street infrastructure, just as a starting place.
Thank you. Okay, well, this is something that we'll talk again about next month. But thank you all for your discussion. Thank you all for the effort that we put into this. I realize that it's been a few months and I thought this was going to be done in 1 month. So I appreciate the patience that we've all had doing this, and we'll be finalizing this within this month, and then we'll present what we would like to see is our final mission statement for this year and possibly in the future. So at the next meeting. So thank you all. And with that, I think we're done with this activity.
Thanks, Kevin. I may have lied to you in terms of the timeline and that this would take, but I actually think it's really important. And I like the fact that we can welcome members of the public to be a part of this process. And at the end of the day, I still think that we've got some good things going on that we can do concurrently while we work through that. So thanks to you. James, are you ready to tell us about Safe Routes to School plan? Or is there anything else I'm missing before we move on?
No, I'm happy to. I'll apologize ahead of time. Hopefully I'm not too choppy. My wife has grad school, so we're stretching our bandwidth probably to its limits right now, but hopefully it'll be okay.
Yeah, I can see some smoke coming out of the background.
It might be my ears. I don't know. Yeah, I just have a very brief presentation or some slides that I can share just to kind of walk you through the forthcoming Safe Routes to School plan. Hopefully folks can see my screen here. All right. Can everyone see everything yet? All right. Oop, okay. I'm having issues here. 1 second. I can't see anyone, but I'm just going to go with it. So again, my name is James Hanig. I'm the Pedestrian Bicycle Coordinator at the Department of Public Works, and I'm very excited to be sharing the work that's been accumulating over, boy, probably 3 or 4 years at this point, which is a Safe Routes to School strategic plan that we conducted through a Transportation Alternatives Program grant in partnership with Tool Design Group, a consultant, and the Wisconsin Bike Fed. And it is moving to a Public Safety and Health Committee on Friday to be heard for adoption. So if you're not familiar with Safe Routes to School, it's an international movement and federal program with funding behind it to really be encouraging more walking and biking to school and programs and infrastructure that would support that. The Wisconsin Bike Fed and Milwaukee Public Schools have a long, well-established program really focused on really exceptional education and encouragement programming around Safe Routes to School. And in fact, this year, the Bike Fed and DPW were awarded a Vision Zero for Youth Innovation Award from the National Center for Safe Routes to School, which was highlighting a lot of the work done around engagement at a few select schools, including Lincoln Avenue School, where students and teachers and the school community were all part of developing designs and solutions around their school. So this plan is really focused on coordinating Safe Routes to School efforts across different agencies and organizations. So it's very organizational oriented. And it includes a number of policies and recommendations, both short and long term, that can be used to really advance Safe Routes to School as a city and district wide program. It focuses on sort of the accepted or national best practices of ease, including engineering, encouragement, empowerment, education, and evaluation. So each of those categories has a series of recommendations and actions in the plan. Equity was another E, and we worked together with our team to really come up with an approach where equity is being applied to each of those different E's, recognizing that in Milwaukee there are disparities, including negative health outcomes that are particularly disproportionate in communities of color in Milwaukee. So all of the recommendations are really focused on how equity can be incorporated into those, addressing those disparities. Instead of going through each of the E's, which we could probably have our own presentation for that, or our meeting, I just want to highlight a few opportunities and examples of the types of things that can be coordinated because of this plan and included as recommendations in the plan. So one of them is just the different agencies, MPS, the Bike Fed, DPW, coordinating applications for things like the upcoming Transportation Alternatives Program, which will be having another round of applications later this year. Using a prioritization criteria that were developed to prioritize projects and investments around schools. And we had already received funding a couple years back to do some infrastructure improvements around 8 schools. And now starting later this summer and going into next year, we'll be doing a locally funded pilot of infrastructure improvements centered around Westside Academy. Things like revising ordinances to allow biking on school grounds and promoting more bike parking on school grounds is just another example. And then continuing to expand the curriculum, the child-friendly cities that MPS and the Bike Fed have been moving forward, especially with the MPS community schools. So with that, I'd field any questions. I do have a copy of the plan. I'll make sure to share a link to it. And you're welcome to tune in to the Public Safety and Health meeting at 9 o'clock on Channel 25 on Friday. But any questions for me? I'll just stop sharing my screen so I can see you all.
So James, I see in the chat, Brian asked, what's the rationale for bikes being banned from school grounds?
That is a great question. It seems to have been a kind of a remnant policy that I don't remember if we even got into what the rationale was when we were putting together the plan. But my sense was at some point in time it was seen as being unsafe for people on the school grounds, or that there would be this conflict between people biking and walking. But it could be other thing. It could be after hours. Maybe there were issues. I'm making a lot of assumptions and speculating. Caressa, I don't know if you happen to know, or if anyone else.
Well, kind of. I think the local government might tell you that if you think about it, a lot of the school properties, well, I shouldn't say a lot of them. Many of them are connected to parks. And I know that county parks actually does not allow people to bike on their trails, like their walking paths, even though people do it all the time. It's hard to enforce that. I will say personally, what I think is that it's an unnecessary ordinance that particularly can target people of color. It's just like, I don't know, jaywalking, or even unfortunately biking on the sidewalk. I know that it's unsafe for pedestrians, and unfortunately cyclists bike on the sidewalk all the time because it's unsafe in the street. But I will say that right now the Bike Fed is actively trying to work to eliminate that particular ordinance. Not biking on sidewalks currently, but the restriction of biking on playgrounds, because most of the children that go through our Safe Routes to School program are learning how to bike on the playground. It's the safest place to do it. We don't really see any reports of issues with our MPS partners where biking on playgrounds is an issue. If anything, we just want to remove that law to protect children, especially Black and brown children, as they age out of our programs and they still might want to enjoy themselves by riding their bike on the playground. So yeah, I think that long story long, I think it's, it doesn't really present itself as an issue, and I think it could present itself as a real danger to certain groups of people, and I think it's completely unnecessary. But at the same time, if you think about people, all ages and abilities, having people biking around in places, especially like on sidewalks where the pedestrian walkway is only so wide, that poses a danger. A lot of people have their own particular stories, but yeah, that's our take on it from the programming side.
Chris, I saw you had your hand raised.
Not anymore. Can you hear me?
Yep. Yeah,
Okay.
not anymore. Well, if there are any other questions, I mean, one other thing is, since this will be another adopted plan by the city, we would be very glad to work with the task force in helping to prioritize different actions, because again, there are probably over 100 specific actions that the city can take. So having, the task force as an advisory body would be very helpful in terms of how we prioritize the various actions. So maybe in future meetings, or if there's a way that I can share that information to get some conversation going on it, let me know.
Considering and based on the email that we saw about subcommittees and working groups, this could actually be a subcommittee for it, right? Because it would have a defined task. The defined task is prioritizing the Safe Ride to School action items, right?
It could be. It would just really depend on I think the way it sounds like we're going to be working is putting some of these important things up, in a list essentially, and working on them. They could be worked on concurrently if the group feels that they have the ability to do it. Or if it's really, really important, if it's a big deal, we could establish another working group specifically for that. But I think kind of condensing it into these two different working groups, particularly policy and programs, might be the best place for it. It would just depend on where it lands on the group's priority. So yeah.
The other thing I was thanks for clarifying that. The other thing I was wondering was, did you need us to submit a letter of support for this?
We would gladly welcome it. I know the Bike Fed is working on submitting one for Friday for the meeting, but I guess it depends on how the group feels about the plan.
Is Michael working on that? Okay. Well, if you all are okay with it, we could also sign on to that letter. Could have Michael. James, can we share this letter with the group to say yay or nay, like outside of working group, to support that letter?
Yeah. Okay.
What do we think?
We would do a vote via email to see if we support it or not.
Yeah, instead of writing a separate document with it being such a kind of a shorter turnaround. If you want me to write a separate one, I can. What's that?
How does our group feel about that?
Yeah.
I'm fine with that. I would, I'd love to see the letter, and then we could vote on it to support it.
Mitch is in favor. Claude, how do you feel about it?
I was trying to give you a thumbs up. I'm not sure if it worked.
Okay, cool. Cynthia, are you still with us?
I think she had to leave.
Okay. Montavious?
Yeah, what are we in favor for and not are in favor for?
So not writing a new letter, just signing on to what the Bike Fed, or to the Bike Fed, what the Bike Fed's letter is going to be, but after we read it, and we would do an electronic vote on that.
Yeah.
I think that's all of us then, right?
Yeah.
Because I mean, I'm in favor. I'm assuming you're in favor. You proposed it, so.
Yeah, that's the majority.
Okay.
But we would definitely share it with you before, just to save some time. It might be more appropriate. Well, we don't have a ton of time left. I'm actually going to skip the items, the announcement items, because they are linked out on the agenda, and save some time for anyone else that wants to share anything that's happening in the vein of safe and healthy streets, anything that's going on, events coming up, etc., that they would like to share before we adjourn.
So I'm looking up, there's a walking group, but I got to look it up. They're going to be meeting for the first time in Pulaski Park for this. Is it June 8th? Was it? Or it's coming up.
I did include that in the minutes as well. So there should be all of the Latinos por Salud walking club and biking clubs. Okay. I have like what the dates and times are.
Okay.
But
cool. I will not look that up because that's what I was thinking about. So thank you.
Rebecca, did you have something to share?
I'd like to see if we can get this on our agenda for July. I don't know if you're taking suggestions for this, but snow removal from the pedestrian right-of-ways, I was working on, and it's not really gone anywhere. And I also had discussions with Alderwoman, can't think of her, Northwest District.
Lewis.
Who?
Lewis.
Yes, Lewis. Thank you, Claude. About snow removal and about a flyer that was done before with a DPW operations. And I had called the water department about maybe having a flyer put in the fall water bill going out with all the service charges, and that you can put flyers in there. And I thought it would be a good idea to have that flyer sent out in every water bill in the fall water bill. So I think that we should go back and address that, because that has to be to the water department in August sometime.
I would agree we should put this on the agenda for July, because we always seem to talk about it in February when it's too late to do anything that year. So let's talk about it when the weather's warm. So maybe something might actually happen.
Thank you.
By the time it snows.
Yes.
Well, thank you, Rebecca, for reminding us of that. I do also want to remind many of you that as an example of something that the policy programs working group could focus on in particular is ice and snow removal. And I would challenge those that are within that group to possibly consider putting that on the top of their priority list, so that when they come in July, or you can suggest to me before we build that agenda in July, maybe you want to invite someone to provide you with some additional insight on how you might want to tackle this particular issue from a small group out into the large group. So I know Claude's on that group, I think, which is good, because he's a champion for that particular subject and many others.
We have a draft letter that we put together.
That's right.
For a year ago that I don't think ever went out. So I'm happy to send that to you and discuss it again.
Well, one thing is important is I think I've made Nicholas the lead of this group. Nicholas has requested notes from our previous small group meetings, and I would definitely suggest shooting that particular letter over to Nicholas, and he can put it in our shared folder for working groups so that we have all of that in one spot.
All right.
All right.
I'll say on that note, we've had some very productive internal meetings with the new leadership in DPW operations. So I think, as you craft that agenda item, definitely consider who you'd want, if you want a report out or if it's more of an internal discussion. But I think they're willing to cooperate.
And that's Danielle Rodriguez. Okay, cool. Well, we're a little bit over time. I would like to respect everyone's time and call for an adjournment with a second.
I'll second.
Okay, Claude, you're on fire. Well, thanks everyone for joining us, and I look forward to hearing more report out from working groups and what everybody's coming up with the next time. It should be quite a meaty next meeting for the Bike Pedestrian Task Force. I appreciate everyone, and have a wonderful evening.
Thanks, everyone.
Good
Take
night,
care.
all.
Thanks, everyone.
Bye-bye.